Many people want to help sick or injured wildlife, but are not sure of where to begin. Most importantly, a wild animal should never be kept as a pet. It is unsafe, unfair to the animal, and illegal. Many people wish to care for the animal on their own, but it's important to remember the complexity of many species' diets, their social structure, and daily needs. Only a credible and licensed wildlife provider should be trusted to care for a wild animal. You can find licensed wildlife rehabilitators in your area through your state's Department of Natural Resources. A link to the Illinois Department of Natural Resources can be found on the Wildlife Medical Clinic's website. Let's think about some situations or signs that an animal requires assistance. Some cases will be very obvious. The animal is having a seizure, is actively bleeding, is unable to use one or more of its limbs, is trapped, or is displaying highly abnormal behaviors. It needs help. Knowing what constitutes abnormal behavior depends on your ability to not only recognize the animal, but have background information on what is normal for that species. Also, keep in mind that behaviors change with age. For example, a fledgling bird may appear to be struggling to fly, but that is completely normal and a stage of development for that bird. Always seek further information when you are unsure of a displayed behavior. Wild animals are very different from tamed ones, and your pets are not a good example. Now let's assume you have found an animal that you believe to be sick or injured. What do you do? First, determine if you can safely intervene. If you can't, don't approach the animal, but contact a wildlife professional for assistance. If you can proceed safely, here are some suggestions. You will want to have a heavy towel or blanket, a sturdy container, heavy gloves, and some sort of eye protection. When approaching the animal, avoid direct eye contact with the animal and try not to talk. When moving the animal, do so with as little fuss as possible. Maintain a dark and quiet environment and minimize the movement of whatever container you've chosen for transport. Do not feed the animal. It may be the wrong food, or you may be using the wrong method of feeding, or the animal might have a medical issue where feeding can worsen their condition. Even giving water to an unstable animal can be detrimental. Assisting flighted birds is challenging, and the use of a net may be necessary. Birds that can't fly should be approached cautiously. Try to confine the bird to a corner that does not offer a place to hide. A visual barrier, like a towel held between yourself and the bird, will help minimize its stress as you approach. Gently cover the bird with a towel or cloth and grasp the bird around its body, making sure to have control of both wings. Transfer the bird quickly into a dark, secure container. If the injured bird is a raptor, such as a hawk or an owl, remember that their beaks and talons are especially dangerous. Rather than trying to pick the bird up with a towel, attempt to nudge the bird into the container. Some wading birds can also cause injury by striking out with their long, pointed beaks. Take care when approaching these birds, and always be sure to use eye protection. Caution should be used when handling adult mammals. Even if using gloves and towels, injury to the animal can occur with improper handling techniques, and your safety can also be compromised. Instead, corral the animal into a secure container. If an open container, such as a trash can or bucket, has been used to trap the animal, slide a sturdy board, a piece of thick plastic, or a metal sheet underneath it and secure with several loops of rope, string, or duct tape to form a makeshift floor. Always recognize that even common wildlife, such as raccoons or foxes, can be dangerous. Common reptiles that may be injured or in need of assistance are snakes and turtles, but should you come across an amphibian, they have some special requirements as well. Snakes and amphibians should not be handled directly. Snakes can be injured by inappropriate handling and can give a nasty bite. Amphibians, such as frogs and salamanders, can absorb contaminants through their skin, so bacteria on your hands or latex in gloves can be very harmful. Turtles, especially in the spring when females are nesting, often are found crossing the road and get hit by cars frequently. If a turtle is found in the road but is uninjured, move it off the road in the direction it was facing. If you move it to the wrong side because you think it looks better, it will simply attempt to recross. If the shell of a turtle has been fractured, gently pick it up so that you avoid the broken areas. You can also use a board shimmied underneath the animal to transport it to a rehab or care facility. A special note, some turtles can inflict a nasty bite, so be careful when handling them and keep your hands towards the tail end of the shell. Overall, rely on common sense when judging whether to handle the animal or not. An injured baby bunny naturally poses less of a threat to your safety than an injured adult red-tailed hawk with a broken wing. If the animal presents significant danger to you, either through overt displays of aggression, or because you're concerned of zoonotic disease, or if you are frightened or scared to approach it, always contact a trained professional for assistance. The Wildlife Medical Clinic is a not-for-profit organization that is dedicated to providing veterinary care to free-living wildlife. Animals in need of assistance may be presented to the University of Illinois Veterinary Teaching Hospital 24 hours a day, 7 days a week. To support our efforts, please visit vetmed.illinois.edu/WMC.